In this lecture, we will discuss how imbalances of sodium and magnesium can affect the EKG. Fortunately for us, sodium imbalances, that is both hypernatremia and hyponatremia, do not really affect the EKG. In addition, they don't affect the cardiac rhythm or impulse conduction despite being involved in the action potential. However, there are some changes that can occur with magnesium imbalances. First off, while hypermagnesemia is rare, if it is severe, it can cause AV or intraventricular conduction disturbances and eventually lead to complete heart block or asystole. On the other hand, if serum magnesium levels are low, it can potentiate the proarrhythmic effects of digoxin as well as predispose the patient to supraventricular and ventricular tachyarrhythmias. So not too much here. Let's quickly review what we discussed before we end here. Okay, so again, sodium imbalances, even though they're involved in the action potential, they really have no effect on the EKG, the rhythm, or conduction. However, hypermagnesium, we said it's rare, but if it's severe, it can have both atrioventricular and intraventricular conduction disturbances, which can lead to complete or third-degree heart block, as well as asystole. In terms of low magnesium levels or hypomagnesemia, this can potentiate the proarrhythmic effects of digoxin, as well as predispose these patients to supraventricular tachycardias or ventricular tachyarrhythmias. Well, that's the end of this lecture. We discussed how imbalances in sodium and magnesium can affect the EKG. I hope you learned something.